What's up, rookies? Welcome to another snippet on what pharmacists do. I'm so happy to have Dr. Shirley Wong back with me on this channel. She was here last time talking about Farms to Home and her program that she was working on delivering pharmacy services to patients' homes. And now she's back to talk to us more specifically about her role as a pharmacist, as a pharmacy resident, and as a pharmacist working somewhere. You're about to find out. And I'm so excited to have you back. Welcome, Shirley. How are you doing?
Thank you so much for having me back. This is really exciting. I love your platform.
I'm so excited, Shirley. So, first thing I want to know is who is Shirley Wong? Why did you decide to do a pharmacy? Why did you decide to pursue a pharmacy career? And how has that journey been for you so far?
I think, yeah. So, hi, everyone. For those who don't know me, my name is Shirley Wong. I'm doing my second year of pharmacy residency with the Farm to Home Initiative at Troy University, California. So, I think it goes back to quite a while, many years ago. So, I've always wanted to do pharmacy, and I think the triggering point was probably around middle school is when I identified medication error, and that happened to one of my family members. And of course, I think at that time, middle school, you don't know anything, you feel helpless, and you didn't realize that, such a small dose of medication can have such a large impact on your body. I think that was my point where then I went to, high school, and then in college I studied chemistry from an undergrad. And then it was like pharmacists, they had like specialties. So it was like pharmaceutical chemistry, which was lucky at that school. And then I applied to pharmacy school from the get-go. But of course, it was unfortunate. I think my first try I didn't get in, which I thought, at that point in time, I felt miserable. Felt like, oh my God, my life is ending.
Same thing happened to me. Yeah.
Yeah. So that I think I reapplied, worked some jobs, continued doing some additional schoolings. And I think it was just like timing, which was perfect. That's how I met like my previous preceptor at that time, Dr. Kapoya, who is now also my current preceptor.
Yeah.
For my residency. So I think it was like life was like in full circle. So I did research at Toral, got my master's, and then reapplied again. And I think all of those different steps, I think, kind of shaped me who I am today. Then I did, of course, I got in pharmacy school. During pharmacy school, I think it was nice to have had worked a technician job right before. So during that time where I was working, and that time I met Dr. Wong, that's how I met her. And I remember the first time when she told me, she's like, oh yeah, I work in a hospital, but I'm also here at Walgreens. And I was thinking to myself, how does she do all this? And that was like kind of my inspiration. Yes, it was my inspiration. I was like, wow, she can do two different roles in pharmacy. And I think at that time, I was still kind of learning because as a technician, I didn't really know too much about the pharmacy world yet. You kind of hear about it like, oh yeah, there are specialties. There's lots of non-traditional roles, but then you don't know until you're like you're in the mud of it.
Yeah, and then so you applied to pharmacy school, and I'm glad you didn't give up because I applied to pharmacy school. I got in on my third attempt.
I think I was on my third attempt too. I applied first time, didn't get in, then second time, didn't get in. Then I was like, oh, this is like ending, like, oh my God, life sucks.
And here you are doing PGY2.
Yeah, so I didn't think I was gonna like go this far, but I think because at that time, I think in hindsight, everything's like 2020 and things like work out. And that's something that I realized all the times that I applied, things worked out for a reason. Because I ended up going to UOP, which is one of the schools I really wanted to go to because they had a Medicare program for students to kind of learn about like insurance, health insurance, how can we lower costs for patients' medications. And so that it kind of all worked out.
Which linked up perfectly with the residencies that you are doing now. So what I'm trying to say by emphasizing this is that failure doesn't mean you're worthless, right? Failure doesn't mean you're not good enough. Failure is redirection. And you kept applying and you got into the school, your number one choice, and it led you to your type of residency that you're interested in, working with elderly Medicare patients and helping them out with their medications. And this is like, it's like fate. So don't give up if you don't get in the first or second or even third time. If it's something that still you're really interested in, that you're really passionate in, don't stop. Just keep trying.
I think it's like the song. You tell yourself, I think, what is it? What doesn't kill you makes you stronger. It's like a little cliche, but it's technically true.
Which one was that? I'm trying to figure out the lyrics, but I'm not remember.
Yeah.
Stronger.
Is that Kelly Clarkson, right?
Yes. And then, see, you didn't get in, but you didn't just stop. Not only did you not stop, you went and you got your master's degree. You figured out other things that you can do in the meantime, right? You just keep improving yourself and keep bettering yourself. So you have a stronger application next year, right?
I think it helped during pharmacy school to work as a technician. So you kind of have that exposure, which I think
we met. Now we
yes.
Here. Who knows where we're going to be tomorrow, working together. Pharmacy is a small world. We talked about this last time, and it's really about networking. And throughout all these years of reapplying, you're getting a master's, you're working as a pharmacy technician, you're making your application stronger, and you're networking, you're meeting people, and eventually, if you don't give up, the reward is amazing.
Yes.
It truly is. So what do you like most about being a pharmacist?
It's like, I have a lot of things I like being a pharmacist. I think all my friends know that I'm super passionate about it. But I think I feel like I think we say that a lot, that we are most successful, which is like, I realize is very true and versatile. We can be in any place, anywhere, and still play a role in the healthcare system.
Yes.
Yeah. And so somebody has questions.
That's why I do this, that you can do it.
Learn about all the different roles.
Anything with a pharmacy degree.
Correct. Yep.
And that's what you like most. Why do we like the same things?
I don't know. It's part I'm telling you, inspiration.
It's crazy. It's crazy. So this is about what pharmacists do. You're a pharmacist. What do you do as a resident, as a pharmacist? Tell us.
I think, in short, we do a lot about every little thing. So, I mean, for currently my responsibilities, I'm involved in academia-related activities. I'm involved in direct patient care. I have opportunities to participate in interprofessional activities in the school. Also have chances to attend national conferences to present research. I think those are all responsibilities that I have currently. And I think just like an overarching, I noticed that like for pharmacists, you can be at the counter at the community location and patients come in to ask you all kinds of questions. Sometimes it's not something you can answer.
Yeah.
Something like you're like, what? I've never heard of that in school. Let me look this up real quick.
So true.
Yeah, and in inpatient pharmacy, I think like doctors always call up like, hey, can I do this bag, or can I dose together this, or the nurse will call up like, can I mix these two bags together? So there's lots of different roles and specialties, like even admin or like specialty pharmacies, industry. Like right now I'm at FQHCs, like the federally qualified healthcare system. So I think there's so many different roles, and it's not just medications. I feel like as a pharmacist, I feel like something that I've noticed is even more important is lifestyle and providing that support system for our patients, because some of them might not have the luxury of having anybody, and they just might have that one pharmacist, to rely on to kind of help them out and get them through that rough patch.
Yeah. So what is a Monday through Friday like for you?
Monday through Friday, I think day to day is very different for me. Because I can schedule my own patients and I can like kind of put them on wherever time slot is, available. So I do scheduling myself, and then there's telehealth, video, phone appointments. Occasionally I'll do
diabetes.
Sorry?
Is your focus diabetes or chronic diseases in general?
So yeah, we do diabetes and we do all kinds of chronic diseases. And there are some like mental health that we can't necessarily help directly in terms of adjusting the medication. So we have collaborative practice protocols, which I think is really unique position for pharmacists. And I think, some hospitals have that protocol in place also for pharmacists to adjust medications, which is a big part.
Yeah.
Sorry.
I was saying adjusting medications. I was just repeating what you said, but adjusting medications being a big part of what pharmacists do, because we are the drug experts. But I'm sorry I interrupted. So we were going over Monday through Friday. You talked about scheduling patients for the day, and then I interrupted you. Go on.
Oh, no, it's okay. This is exciting. We're like, oh my God, so many things to talk about.
Yes. Go ahead.
So I do home visits, and then I think my pharmacy students who are on APPEs with me get to go with me to the home visits, and then we go to their homes, can assess their current medication regimen, which is a very unique opportunity. I don't think you rarely hear that a pharmacist goes to your home.
So unique. Those pharmacy students are lucky to have such rotations. Because
Yeah.
seriously, the only time I hear about people going to patients' homes is maybe social workers or home infusion nurses, or it's never. I've never heard of pharmacists doing this. I've heard of public health nurses. Why don't we have public health pharmacists?
Oh yeah,
If we
that
do
is
public
okay.
health, right?
Yeah, it is basic
That's
public
that's
health.
that's that's a different conversation.
But yeah, I think it's nice because for students and for myself, we've never been in that position, and so everything's new. So when we go there, we're like, okay, what are we gonna do? So we assess our medications, and I think a lot of physicians appreciate it because they're confused when they come. They might bring some of their medication bottles, and then it doesn't clear up the whole picture. But when we're at their home, they can show us all of it. And then we can say, oh, it looks like this one's expired for, I don't know, 2 years ago. You might not want to be taking that one anymore. And I think one of the most beneficial things I noticed from home visits is identifying those barriers that we probably wouldn't have known unless they verbalize that. Yeah, and social determinants of health, which is all part of public health.
Going to home is priceless because you can be like, the patients will show you what they have and you see something else over there. You're like, oh, so, but what's that? And like,
oh yeah, you open a cabinet. I'm like, can I take a look at that one too?
and you discover all these things that the patient didn't tell you about that could potentially be affecting some aspect of their health. So it's very priceless, very unique, very unique.
Yeah.
So that's what
And
you
I
do
think
Monday through Friday?
Monday through Friday, yeah. And then recently we started back going to the clinics, and our role there is to identify the medications and reconcile them for the providers there. So those who are admitted to the emergency room multiple times or hospital readmissions. And our goal is to kind of reconcile. So hopefully we can figure out a plan for them, and then therefore it makes the physician visits easier. So they don't have to worry about, the medications portion, because that takes ample time, and then they can't focus on the real problem.
Yeah, exactly.
That's one part.
Yeah, it's one part, but it's a one very important part. So you see a lot of patients. Do you have a memorable patient care experience to share with us? Something that you really felt like, yeah, as a pharmacist, I truly have an impact on these patients.
Yes. So I have two. So I'm gonna try to share them as quick as I can.
Yeah, no, we're
I
not in a
think
rush. We can do part 2 if we need to.
yeah, I think there's been a lot of memorable patient experiences, and I think I've learned from them, which I know it's like weird sounding that you learn from patients, but you do. Some of their life stories and then the way things that they go through, it kind of, yeah, you learn how to communicate differently because everybody's background is different. Everybody's level of understanding or education is different. And so that was like kind of teaching me how I can communicate to different people. I think like the very first one was probably the first home visit. That was like, me and my pharmacy student, I'm like, this is our first time on a home visit together, and you and I are the first ones. And so that was definitely like non-traditional. And then we did our history taking. We helped them apply diabetes technology and help teach them how to utilize the sensors, because they told us, oh, this was after we taught them how to use the sensor. They're like, yeah, I spent like a couple hours trying to figure out my own glucometer when I first got diagnosed, and like nobody showed me, and I was just trying to poke trial and error. And he was like, I'm so thankful you came, and then we did this in like less than an hour, where he didn't have to struggle on his own, and he felt like, if you have questions, just reach out. That was like one of the very first, probably most memorable.
Just to add on to that, I had a patient who said, I haven't checking my blood sugars because my glucometer is broken. And did you try changing the battery? And he said, oh, they have batteries? And I was like, yes, ma'am. Yes, they do. Go to your local pharmacy, ask them for batteries. And I called him the next day just to follow up. He said, it's working.
Oh my God, that's so fun.
Like simple things like that, like just figuring out how to use a glucometer for the first time. And for that to be a memorable patient care experience for you, you must have really felt the impact that it had on that patient who had spent hours trying to figure out how to turn on and maybe calibrate and then insert the test strip.
And then where to put the blood, I think that's always hard. And some people have dexterity issues, which is like even harder because they're like shaking or they have Parkinson's, and it's like really difficult. Or
Yeah,
some of them don't have really good blood flow to their hands. They're like squeezing, trying to get the blood out.
yeah, man.
Yeah. I think something you reminded me, the blood pressure monitor. I think everybody, so like we would send prescriptions and the patient would get their blood pressure monitor, they're like, it doesn't work. And I would think to myself, huh, that's weird. I was like, yeah, the battery situation. And I didn't realize that blood pressure monitors don't come with that. You have to buy them separately.
They don't like run on their own.
Yeah,
Oh,
they thought like, oh, at the doctor's you just press the button. So they thought like I put it on my arm and then you press the button and it works.
yeah. Yeah.
Um,
Someone other than the pharmacist could have done it, of course, right? But just talking about the accessibility, like
mm-hmm,
having us to talk to on the phone or in person when scheduling a doctor's appointment or an appointment with a
mm-hmm,
nurse. You can't schedule appointment with like nurse educators for these type of
mm-hmm,
things. But you have to call and make the appointment and
mm-hmm,
wait for your appointment time. And that just discourages some patients. But me in the diabetes clinic, I have a list of patients that I'm calling and following up on, and I call them. And
mm-hmm,
sometimes I call them 2, 3 times. I'm like, why aren't
mm-hmm.
you picking up my phone? And I leave them a message. Just talking about accessibility. Like when it's our role, we're there for our patients. That's what we do, and we're always reaching out to those patients.
Mm-hmm. Which I think is nice that you call them because like multiple times, and so they understand, we were there for you,
Yeah, yeah,
and
yeah.
like you can call us back anytime, but hopefully we're still in office.
Yeah, yeah. And I tell them, if you don't want to talk to me, okay, you can leave your blood sugar readings on my voicemail and I'll call you back with the titration and I'll leave that on your voicemail, just really pushing it, just really
Mm-hmm.
pushing, encouraging the patient to stay involved in the
Yes,
healthcare management. But you said
I
you had
want.
two.
Yeah, can I share my second one?
Yes. What is the second?
So I think the second one definitely pushed me to like it's like challenging, pushed me to my limits at that point in time. Just because I think in pharmacy school we're not really trained about like suicide prevention or mental health. It covers a little bit, we know the medications, we know the drugs, but when it comes to the difficult situation when you're there, they don't that's something you have to kind of learn how to communicate to that person because any kind of like, words or something could stimulate them or like worsen the condition.
What
And so I
happened?
remember yeah, I remember one of my patient staff like called us like early in the morning. I think this was like 7:30, 7:45, and I was just already there. So, I called them back. I'm like, hey, what's going on? And they're like, oh, my spouse is having suicidal ideation. There's been so many things going around at home, friends and family like passing away. And then like their health was just like going on a downward spiral just when we thought it was getting better. They're like, oh yeah, now I gotta go back to the hospital and so many things happening. I think it just was overwhelming for that patient and she was just struggling. And so it was really traumatic because they locked themselves in the like room and nobody could enter. And so we're like concerned. They're saying statements where it's like alarming, like, and we're worried that you're going to hurt yourself. And of course when I heard the phone call I was like in pause, I panicked and I was just like silent for a good like 30 seconds,
You're like, what do
not
I
sure.
got? I haven't
I was
been
like
trained for this kind of thing.
yeah, I was like, I have nobody right now, like next to me. I'm like, who do I ask? Like, what am I supposed to do? And then I think I was really grateful that timing just I don't know why it just happened that way, but I had done what we call a QPR gateway, I think gatekeeping training. It was taught like by Dr. Tammy Hendricks at Torrey University. And so we learned about different ways of how you can like prevent suicide.
What's
And they have
What's QPR?
QPR. So I believe
Is that
Q
kind of
means
a
question.
questionnaire
Yeah, yeah,
assessment?
question, persuade, and refer. And so it's like like the step-by-step process and how you can potentially prevent suicide.
Was
Of
that
course,
training part of your pharmacy residency training?
no, it was just in addition. It was an opportunity, so I just did it in addition. Yeah, I was at a university, so
It
they
was
have
optional and you did it.
yes,
And then you encountered, oh my God, okay, I'm
a
sorry, hold on.
situation.
So do
Yeah,
you
I had
remember
a
QPR
situation.
and what did you do with it? But that was the patient's wife on the phone, you said.
Patients,
Or
yes,
spouse.
their husband.
Okay. Oh,
Hmm.
okay. So
Yeah, yeah. And then they're like, okay, well, I don't want to hurt her and I don't want her to get hurt. And then like I totally understand the situation. I think my first thought was like, well, how am I going to calm both parties down? Because obviously one side is panicking because the other person's like walked in there, but the other person's also panicking and verbalizing that they want to hurt themselves because they just can't, take it anymore. And I'm thinking in my head, like, I'm not physically there. And how can I get, additional help? We need probably enforcement to like come out here and like assess the situation because we're not in the same cities and like we're not in the same area. And so this was all through phone. And so many factors that you can't control. But I think fortunately we're just having communications and we kind of talk through the things that are positive, more on the positive end. And kind of, I know for them, it's hard, right? When they're in that moment, you have so many thoughts going on and you can't change that. But I think just having someone there talking to them helps. And we kind of de-escalate the situation. So fortunately, we had external assistants come through and they were able to go to the hospital. But I panicked because I didn't know their address. And then I was like, somebody has to tell me the address. And then I was like, I need to access the chart to find their address. And I'm like asking the husband, but the husband was like kind of concerned, which I understand because it's like you never know what happens, right? The thing in that situation was just, simply they were able to share their thoughts afterwards. They called me back and they're like, okay, thank you so much. And then sometimes, our visits are just you share your thoughts, what you're thinking about. We're not really doing any clinical aspects. And that's what I realized as pharmacists. You don't always have to have something clinical to talk about. You can talk about their life, and that's just like us understanding that patient's perspective about their health. You don't even have to ask anything like formal history taking.
Yeah. And that's why I feel it's because of that mindset that you have that the patient's spouse called you. Because they could have called 911. They could have called, I don't know, the suicide line prevention. I really have no idea how to handle this kind of situation. But you were the first person that came to their mind.
Yeah, this was first thing in the morning. So when I came in, I was like, oh no. But I think it's like building the trust over
That shows
time.
the trust that they have in you. That shows that pharmacists are trusted healthcare professionals. Hello.
Yeah, and I think I mentioned the
Wow.
last episode that trust is not built overnight.
And it's not built overnight. That's absolutely true. It's absolutely true. That is, I have never, ever, ever heard any encounter like that.
Yeah, so I think message to the pharmacists out there, you can prevent and save someone's life, whether you're counseling on an antidepressant, antipsychotic, right? I think you just never know what people are thinking. And just that moment in time, your consult could make a difference. You might not know it, but it
You might not
could.
know it. You might not know it. And that's why you mentioned being accessible, you mentioned being trusted, and then trust is not built over time. And it's not built over time because the patient needs to sense that you know your stuff, you know your medications, you know what you're talking about, you care about them, because you don't always have to talk about clinical stuff, which you clearly said. It could just be anything going on in a person's life. That's how you build relationships and trust with your patients, whether you're in community practice, whether you're in ambulatory care practice, talking to patients in clinic, and even in the hospital. If I go and talk to a patient about when patients are admitted, for example, and I want to go do an medication admission reconciliation, when I walk in and introduce myself, I always want to show that I'm here to take care of you. I'm not just here to ask what medications are you taking at home, what's the name, what's the strength, but how are you feeling today? How did you get here? Like, why did you get here? And then that will get them talking about a fight,
All kinds of things.
your boyfriend, all kinds of things. And then you acknowledge, and then you listen, and then you sympathize, and then and then you kind of start to throw in the medications in there. But really, it's a human.
Like subtly.
Yeah, like
I still gotta know
about
about
it.
this.
Yeah, because you have to remember you're talking to another human being, and you're taking care of a human being. You're trying to make a human being better. You're such a great pharmacist, Dr. Shirley Wong. So what advice do you have for any prospective pharmacy student, anyone aspiring to become a pharmacist? Because pharmacy school enrollment has gone down a lot. People are wondering, is it still worth it to pursue a pharmacy career? Why do I have to get all the student loans and be treated like that because many pharmacists, especially in outpatient, are going through a hard time, even in healthcare, especially with the advent of COVID. healthcare providers are stressed, not just pharmacists. So some people are having doubts. What advice do you have about what pharmacy is all about, and then the reward that it brings, and how good of a career it is, and how to make it through? That's a lot of questions, but yeah, what advice do you have for people interested in getting into pharmacists, and even people who are currently in pharmacy or newly graduate pharmacists who maybe may be considering residency? What advice do you have in how to get in and how to succeed in the career and do well?
I think first, I think I'm in a position where I'm really fortunate that I have interprofessionalism involved. So I get to work with different doctors, nurse practitioners, PAs, and they value pharmacists' presence. And, you know, whenever there's a question, they're like, oh, hey, let me go ask my pharmacist. And I understand that not every setting is always like that. And oftentimes, I think, yes, the pharmacist, like in a community setting, is spread really thin. And I can see that myself, like, you know, you have so many different things going on, but you're just one person. And I wouldn't say that, I guess it's hard. I can't speak for everybody, but I would say when you're in, I guess you have to know why you want to go to pharmacy school first, and you have to know why you want to go into healthcare. I think the motivation of why you want to go into healthcare will make a difference in how you go through pharmacy school. Because if you never wanted to be there in the first place, you'll never have fun. And I think you'll always just felt like struggle, like, oh, this is just another class. I gotta get through.
Yes,
Oh,
yes. Know your why. The reason that is what keeps you going. That is what kept you going after you didn't get in 2 times. That is what kept you going and got you to do a PGY2 residency. You know you want to be in healthcare. You know you want to be involved in medication management, and that's what you want, and nothing else is going to do. So if that's your why, you can keep pushing on.
And I think kind of like curiosity, I think pharmacy has lots of specialties and career paths, and I think there's many pharmacists who go through non-traditional routes. So like here, and you know, my residency program is not accredited, but I think I'm getting a lot of the different experiences, right? Teaching API students, which never in my life would I think I'd be teaching another
You're
student.
A professor, hello, academia.
Like something, yeah.
You're teaching, you're doing clinical care, telehealth, inpatient visits.
Yeah, journal clubs. We have journal. I hated journal clubs as a student, and I can see the value now.
I still do to this day, but it's so valuable.
It is. I don't realize it until now, but it's okay. It's never too late.
Yes. So know your why. There's so many options. Farm to home is one of them. That is like such a non-traditional program. How do you can do anything with your pharmacy degree?
Correct.
You create your own startup if what's happening right now does not serve your purpose. If you have an idea on how you want to take care of patients and nobody else is doing it, you can do it. You have a doctorate degree.
And it's hard to start up, but you can do it.
Yeah. People are going to rely on your expertise. You can be a consultant for Amazon, for any company trying to start something medication related. So as long as you have that knowledge, you have that degree, you can adapt it to any situation where it's needed. So there's so much you can do. You just have to keep an open mind, and you have to dream and think about how you're going to make that happen.
And I think,
because you have any more?
I have a couple more, but I think on the topic of the specialties, one of my friends doing something in like radiation and like, I forget what that kind of pharmacy is, but they're
nuclear,
like radiation.
Nuclear pharmacy?
Nuclear pharmacy, that's it. And I thought to myself, like, what is that?
Are you guys making nuclear bombs over there?
Yeah. And
I
like
had to look it up too a couple of years ago. I was like, what is a nuclear pharmacist? So what does your friend do? Maybe she can come on and tell us about it. Ask her.
So they're doing nuclear pharmacy, which I was like, oh, that's interesting. That's something like we don't learn in school. We don't learn about nuclear pharmacy very much. We have industry. I think that's very well known now. Like fellowships, lots of opportunities. If you like talking to people, you can work at drug companies. Any drug company you're like dying to work for. I think pharmacy is it.
I love talking to people. and see, that's the other thing. Right now, I'm a clinical pharmacist in an inpatient setting. Tomorrow, I can decide I want to be in industry. I want to be with drug companies because I like talking to people, and I can pivot like that and start a new career. Same degree, new career.
You can, yeah, and I think when I was in pharmacy school, I did an entrepreneur class too, and so you can start up your own pharmacy, and you learn about the different budgets and whatnot. So that's like in addition to your course curriculum. But I thought I was like interesting, but I don't think I could start up a pharmacy. Maybe not now.
Maybe whatever you mentioned it, your why. If it aligns with your why not? Why not? Why not?
I would say, I think never feel complacent. I think wherever you are in stage of like schooling or challenge yourself. And I think, yeah, that will make you motivated and strive to reach whatever goals. And you know what? You have one goal, you reached it, and you're like thinking, God, I already reached it. Now you have something new to go for.
Yes, yes. I was just listening to something the other day, and the person, I don't remember the name, he was saying that in life, the top of one mountain, it's the bottom of the next. So you work at a goal, you reach it. Now what? Set a new goal and then reach it. Isn't that
so
the
good.
top of one mountain is the bottom of the next?
I love that. I'm gonna keep that in mind now. I'm gonna, yes.
It's true if you don't stay complacent. If you keep thinking about what's next. And life is a journey. You cannot be complacent, whether it's in your career, whether it's at home, whether it's in, retirement. Okay, I went to Hawaii this year. Next year, where do I want to go? You keep thinking about, what's next. And that should be the same in your career. That is amazing advice. And that's the way I do it is doing continuing education. And then those are the easiest way I've found to access continuing education is like through my local pharmacy organizations who have dinners and certifications and things like that. Yeah.
So those are all good ways. Actually, that gives me ideas of what I need to do.
Yes, exactly.
Keep updated on the guidelines because there's always updates every year.
Yes, always updates. And you will get questions from providers and patients about those updates one way or another.
I know time is short, but I do have like a couple more. So I think along the same lines, you mentioned about Hawaii, right? So I think life does get busy, school gets busy, you're an undergrad, you're busy trying to think about, oh my God, what do I want to do with my life? But I think always spend time for your well-being, which is something that I didn't realize when I was going through school. It's because when you're burnt out, you don't want to do anything. You're going to be like, I don't want to do nothing.
And that's so good. That's so good. That's so good. You cannot pour from an empty cup. You have to take care of yourself. You have to be full before you can pour into your patients.
Yeah. So put yourself before your patients, but of course you want to put your patients first at always. But sometimes you got to put yourself first before you can fully, help them out.
Yeah. That's so good, Shirley. You said you had two more, one more. I
have another one. Actually, now that I thought about it, I think it's the last one. I promise, last one.
Have as many as you want. I told you we can do what pharmacists do with Dr. Shirley Wong part 2 if we have to.
That's funny. But I think this is something that a lot of people can relate. I think this goes with all healthcare is that imposter syndrome that everybody has, lack of confidence in whatever field you're in. Of course, in pharmacy, right, you never just know your drugs right from the get-go. I think, day one, even before pharmacy school, or if you're working at technician, you didn't know that drug when you worked, but it's okay. And I think always celebrate those mini milestones or accomplishments as you're going along, because sometimes if you just take like that 10-15 minutes, think about how far you've come and keep that mindset with you that you are good enough. And so don't ever let anybody tell you otherwise.
Oh my gosh, that is so good. And all the advice you gave apply to anyone who's interested in pharmacy school and anyone who is currently in and struggling with imposter syndrome, especially in students and new pharmacists, is huge. And we get so worried about not having imposter syndrome because we think we don't know anything, and we're constantly trying to work hard and learn and study this, that we forget to take care of ourselves, and we forget self-care, and we forget that we have to fill our cup before we can pour out into other people's cups. Those are such amazing pieces of advice you just gave us. Thank you so much, Shirley, for coming
Thank
on
you.
and sharing your amazing pharmacy journey, your persistence, your resiliency, your strengths really are a true inspiration to me. And I'm sure many other pharmacists and aspiring pharmacists out there will find it so. If you really liked this video, please like it, give it a thumbs up, subscribe to our YouTube channel so we can get that motivation and inspiration to continue to do more. And if you are a pharmacist and want to share your experiences, please reach out to me and let me know, and we can talk about what it is that you do in your specific pharmacy setting. That nuclear pharmacist, you need to hook me up with her. We need to talk about that. That would be
I
so.
have one for pediatric too, if you want a pediatric
Yes,
pharmacy.
we'll talk about that off the record.
Yes.
Until the next episode, please stay blessed, stay safe. God bless you. I love you. Bye-bye.